Hi, this is Dr. A. This is your clinical chemistry review on enzymes, and we're going to talk about amylase and lipase. All right, so start with amylase. So amylase catalyzes the hydrolysis of the alpha glycosidic bonds in starches and stuff in order to release various sugars from starches. So starches would be like breads, pasta, rice, but also vegetables and fruit and stuff like that. It is produced from the acinar cells of the pancreas and the salivary glands. So you have pancreatic amylase and salivary amylase. Salivary amylase is what can be responsible for the sweetness of bread and pasta as you chew it in your mouth and stuff. So anyway, releases sugars from starches. That's what amylase does. The greatest elevation of serum amylase activity are seen in acute pancreatitis and also salivary gland inflammation such as mumps. To diagnose acute pancreatitis, you need amylase and lipase. They peak at 12 hours and then, well, amylase peaks at 12 hours and returns to normal in 3 to 4 days after pancreatitis. The lab method for amylase is a coupled enzymatic reaction that results in the measurement of NAD at 340 nanometers and the violet range. And testing is available to measure the activities of pancreatic and salivary amylase. So if you are seeing an elevation and it might be caused from salivary or something like that, you need to distinguish that. There are ways to do that. The range for amylase is 27 to 131 international units per liter, but if the patient has like pancreatitis, you're going to see elevated, often beyond 1,000 or 2,000, sometimes even as high as 3,000 to 4,000. So you would see high levels in acute pancreatitis, so 4 to 6 times upper limit of normal. Pancreatic duct obstruction also would cause high levels of amylase. Pancreatic abscesses, cholecystitis, so that's gallbladder inflammation is cholecystitis, and even like gallstones and stuff like that, which would cause a pancreatic duct obstruction, if you will, or at least a common bile duct obstruction. So there is where the bile duct from the gallbladder and from the pancreas come together. If that's blocked, that can cause problems too. Obviously, salivary conditions such as mumps, intestinal obstructions also, especially in that duodenum, then it would mess with it. And then mesenteric thrombosis can all cause high amylase. And then low levels are going to be seen as cystic fibrosis because they have problems with function of the pancreas due to the cystic fibrosis, the thick mucus that accumulates in a lot of areas in the lungs and pancreas are 2 of them. Also, below in hepatitis and in cirrhosis of the liver. Lipase, so it catalyzes the hydrolysis of triglycerides into glycerol and fatty acids, so it breaks down your fats, such as come from butter and fatty meats and stuff like that. It exists almost exclusively in the pancreas, although you also have intestinal lipase that's produced in the intestine, right? So it is almost exclusively of pancreatic origin, at least the lipase that's found in the blood. During acute pancreatitis, the lipase levels will peak at 24 hours, but they don't return to normal until 8 to 14 days later. So they stay elevated longer than amylase does. So that's why when you're looking for pancreatitis, acute pancreatitis, you want to run both because you may or may not know how long they've been sick. So lipase definitely stays elevated longer, so you would be more liable to catch that elevation. So increased lipase activity is more specific than amylase activity when diagnosing acute pancreatitis. It's also, of course, not affected by the salivary gland conditions and stuff like that. So the lab methods are usually, they estimate liberated fatty acids in their trigonometric method. The range for lipase is 31 to 186 international units per liter. Again, some of these ranges may vary from lab to lab. You would see high levels in acute pancreatitis and be 3 to 10 times upper limit of normal. You can see it also, of course, high in pancreatic duct obstruction, pancreatic abscesses, pancreatic cancer, and cholecystitis, with, of course, a lot of these being similar to the increases in amylase, and it would be low in cystic fibrosis for the same reason then that amylase would be low in cystic fibrosis. All right, so that's it. That is your presentation on amylase and lipase. Thank you for your kind attention.